Advanced manipulations on the upper trapezius tend to focus on kneading types of things. I've got a pincer grip that I pick up the trapezius. As I pick up, I can just shift the bulk of the trapezius laterally, or I can pick it up and torque it. Usually it torques better anteriorly than posteriorly because of course it's anchored along the clavicle here. The upper trapezius can be kneaded with the flats of the phalanges and then scooped along the side of the hand here. Any of these manipulations could be repeated for, half a dozen strokes up to a minute or so of the manipulation. Eventually, you usually want to find hypertonic bands within the trapezius. If you're having a hard time differentiating any of them, if you shift the shoulder down half an inch or so, you'll be able to scan the muscle for hypertonic bands more easily. When you find a hypertonic band, if you travel along it, you find the most irritable spot, which tends to have the most resistance to compression. And I just tend to meet the inherent resistance in that hypertonic tissue. And now again, I let myself entrain with my client. I sense the movement of her shoulder and of the upper trapezius as she breathes. So the upper trapezius, as I'm doing this, often becomes like a giant sort of soft parachute. If you've ever seen a parachute that's on the ground and it's just gradually deflating, the upper trapezius billows and softens and allows my thumb to gradually intrude further into it. Usually after 3 releases or so, the muscle is more available for stripping manipulation. So I strip from the area that I got the release in, all the way up to one attachment point, and strip all the way down to the other attachment point. So stripping manipulations. These stripping manipulations can be carried all the way through the substance of the muscle. And then the completion of this is to stretch the muscle, which is really to pull the shoulder and the head apart from each other. But because the upper trapezius attaches to about 1/3 of the superior nuchal line, we need to turn that attachment point away from the other attachment point here. You notice as we do that, then the border of the trapezius stands up visually. So the stretch position is like this. You need to support your client's head quite securely. Hold on to that shoulder, and the two of you just relax and breathe for at least 30 seconds. And that's a good initial treatment of the upper trapezius.